Hi, I'm Dan Appleman. I'm an author on pluralsight.com, where one of my courses, Objectivity in Data Visualization, teaches how to spot bias and even outright lies in data presentations, and how you can do your own interpretation of data to find something closer to the truth. When I published the course last year, the COVID-19 pandemic had not even started. But today, it provides an amazing source of data, data charts, and people speaking about data. So I thought I'd apply the techniques taught in my course on some of the data and data visualizations that I've seen. I hope you find it enlightening. The first thing I must stress is that accuracy and objectivity are two very different things. Accuracy is a question of whether the data is real or just made up. Objectivity speaks to the story you tell with the data. That's where things get tricky, because there is always a story. Let me give you a simple example that isn't related to COVID-19. On a July 15th interview with CBS, President Trump was asked why Black people were still dying at the hands of law enforcement, and the president answered that more white people are being killed by police than Black people. This is absolutely true. It is accurate. According to a Washington Post database, 1,301 Black people had been killed by police since 2015, while 2,495 white people were killed by police during the same period. However, the population of the US is 60.1% white and 13.4% Black, which means that a Black person is 2.34 times more likely to be killed by the police than a white person. This number is also accurate. When the reporter asked the question, they were looking at that 2.34 number and telling the story that police kill Black people more frequently than white people in proportion to their population. When the president answered that more white people have been killed by police than Black people, he either did not understand the difference between total and proportional numbers, or chose to use the total number in order to tell a different story, to essentially negate the concern about racial bias among police. They are looking at the same accurate data, but are presenting it differently and using it to tell different stories. The way we choose to portray a number matters as well. What follows is an exercise in estimating. It's based on numbers at the time I created this content. Also, I'm using US national statistics, so the results I show will almost certainly not reflect the actual numbers for a particular location. The idea here is to present a way of looking at data that you can potentially apply to your own city, county, or country. It's very difficult to know at this time what is the true case fatality rate by age of the COVID-19 virus. On July 22, 2020, the CDC shows 130,250 deaths due to COVID-19, with 3.8 million confirmed cases. The true number of cases is unknown, since many are asymptomatic or never get tested. The CDC estimates that the true case count is 10 times that number, so let's use 38 million as the actual number of cases. The CDC data shows 16 children between the age of 5 and 14 died of COVID-19 during that period. That age group represents about 15% of the total population. Let's assume that the proportion of people infected is the same across all age groups. In other words, kids get infected but are largely asymptomatic or have mild symptoms. This is a big assumption. By the time you see this, we may know a lot more. But that's the nature of a new virus. We are all still figuring things out. This assumption means that of the 38 million cases, 5.7 million were kids, leading to a death rate of 16 over 5.7 million, or 0.0003%. At which point, all of those who advocate reopening schools during the pandemic jump for joy and say, look, going back to school is not dangerous. We should reopen the schools as quickly as possible. Okay, so let's say 45 million or so kids go back to school. Every teacher knows that schools are petri dishes for disease spread. Still, not every kid is going to get exposed, especially if there are safety measures in place. So let's say 20 million get infected and bring the disease home. Not every child has two parents, and not every parent is going to get sick. So let's estimate that 30 million parents will then become infected. Parents vary by age, and if we were thorough, we'd drill deeper into that. But for our purposes, let's assume that the parents are evenly distributed between the ages of 25 and 54. By our July 22nd date, we've had 9,912 deaths in those age ranges. That age group represents 21% of the overall population. Following the same logic as before, 7.9 million cases were in that age group, leading to a death rate of about 0.12%. Now, those are estimates, but if you look around the multitude of COVID-19 sites, you'll see that they are in the ballpark of numbers you'll find elsewhere. Let's assume for this exercise that the numbers I've shown here are accurate. 0.12%. That's still a small number. We can tell the story that the risk is very low. But we can portray it differently. If 30 million parents are going to be infected by reopening schools, we're going to lose 36,000 parents. I'm not going to calculate how many orphans that leaves. If you reopen a school with 1,000 students, odds are one of them is going to lose a parent. And that's not even counting grandparents and others who will subsequently be infected, or the fact that many more parents who are infected but do not die will suffer lasting health effects. Now we're telling a different story, a much scarier one. Let's look again at that 0.12%. That's the number you're looking at if you're a parent. If you send your kids back to school and they infect you, your kids will be fine, but your risk of dying is 0.12%. That's very low. But if I tell you your odds of dying are about 1 in 1,000, well, that sounds worse, doesn't it? Or how about this? Your odds of dying in a motor vehicle accident in a given year are about 1 in 8,000, or 0.012%, which means that if you send your kids to school and they infect you, you become 10 times more likely to be killed by COVID-19 than in a car accident. As you can see, how we portray the data that we find matters. Sometimes people choose the portrayal that tells the story that they want to tell. Sometimes people interpret the story based on how the data is presented and don't even realize that there are other possible stories that can be told from the data. Thus, even complete and accurate data will almost inevitably tell a story and portray a bias, even if there is no intent to deceive or distort. It turns out that it is incredibly difficult to be objective even if you have perfect data, and in the case of COVID-19, the data we have is far from perfect. Let's take a look at some common COVID-19 data visualizations, and you'll see what I mean. The COVID-19 dashboard by the Center for Systems, Science, and Engineering at Johns Hopkins University is one of the earliest and still most popular data visualizations of the virus spread. What stories does it tell? It visualizes the total number of cases and deaths in various locations. That's what you see by default. It answers the question, how has your country, or state, or county handled the pandemic compared to others? In a sense, it frames the pandemic as a contest between localities, one which at this time the United States is obviously losing. Or is it? These again are total numbers. They aren't proportional to population. We'll have to look elsewhere to see how the US is really doing. On the same theme, let's look at the state numbers. California is winning here, or I guess it's losing. But this is actually a great example of how difficult it is to tell objective stories based on the numbers. During the recent surge in infections, Texas and Florida were called out by the media as having a huge surge because they opened too early. California was frequently left out of the reports. Some accused the media of bias, pointing out that the total number of cases in all 3 states had exploded. Why was the media leaving out California, a blue state with a Democratic governor, while focusing on Texas and Florida, red states with Republican governors? Surely this is a sign of media bias. When you look more closely at the total number of cases and deaths, you see a different story. California has a larger population, so its actual case rate is lower. But wait, Isn't Texas's death rate lower than California's? Surely this must be media bias, right? Well, not really. The numbers from this dashboard cover the entire duration of the pandemic. California was hit hard in March and April, much harder than Texas and Florida. So these cumulative numbers tell a story of how states have done overall, but don't help much when it comes to determining how they are really doing now. Also, when comparing charts side by side, be sure to examine the scales. Differences in scales can mislead you. At first glance, it looks like California's current daily case count is higher than Florida or Texas, but the scale on the California chart only goes to 15,000. It's 20,000 on the Texas and Florida charts. To get a better sense, let's take a look at the COVID-19 projections at healthdata.org, another very popular site for COVID-19 statistics. On July 18th, California had 110 deaths, Florida had 101 deaths, and Texas had 111 deaths. Looking at the charts side by side, you'd think California has the highest number of deaths, but it doesn't, as the three charts have different vertical scales. California's population of 39.5 million is considerably larger than that of Texas at 29 million and Florida at 21.5 million. So California's daily number of deaths per million population is actually smaller. Even so, it's not that much smaller. So while it's fair to say that things are worse in Texas and Florida than in California, the story that California is being left out due to some kind of media bias is still plausible. All three opened back up too early. Or did they? Let's look at a different visualization from the healthdata.org site. Deaths are a lagging indicator. They come weeks after the cases appear. So this site, like others, uses sophisticated models to predict the likely number of hospitalizations and deaths based on the number of cases today. Let's take a look at the hospital utilization chart. The area in blue shows the range of ICU beds that will be needed. As you can see, Florida may be in big trouble. As soon as you need more ICU beds than you have, not only do you start losing more COVID-19 patients, you start losing more people in general, as ICU beds are not available for those who are having heart attacks or other diseases. When the hospital system is overwhelmed, the mortality rate skyrockets. That's part of the reason why New York has a much higher number of total deaths than California, despite California having had more cases. If you look at Texas, the situation is potentially even worse. Indeed, today we are already hearing stories of some hospitals expecting to send people home to die because of lack of ICU beds. Now look at California. At no point in the forecast does the need for ICU beds exceed the number of beds available, though it comes very close. As it stands today, California's hospital system does not look like it will be overwhelmed by the increase. So the fact that California is not mentioned as often as Texas and Florida may not be media bias after all. It may reflect the fact that it simply isn't in as dire straits. It also points us to yet another story. Many countries tell a story of suppressing the virus through a lockdown to the point where aggressive testing and contact tracing would allow them to keep the virus at a very low level over a long term, long enough to allow most businesses to open and activities to resume with minimal risk. This story was largely abandoned by the United States some time ago, in practice if not by intent. Instead, the story was to flatten the curve, to bring down the initial spread of the virus, and use that time to beef up hospital systems and resources, then to gradually reopen knowing that cases would increase, but accepting that as long as the healthcare system could handle the load. By that standard, it is looking at the moment like Texas and Florida did indeed reopen too early, as their healthcare systems are at risk of being overloaded. It looks like California did not, though this may yet be proven wrong. The stories we choose to tell are framed by the data, but data can tell multiple stories. I could just as well tell the story that California, after investing so much effort to lock down and flatten the curve, has failed by allowing cases to surge again, pointing to New York as the real success story in the United States. New York is only running about 30 deaths per day. On the other hand, they have half the population of California, so it would be the equivalent of 60 deaths in California, and California's daily death rate is 100, so they aren't really doing that much better than California right now, even with the recent surge. On the other hand, their numbers are stable, whereas California's are still growing. But New York is doing so much better than they were. They far exceeded not only available ICU beds, but available hospital beds as well. Having seen the worst, it's quite possible that New Yorkers are taking social distancing and wearing masks much more seriously than other parts of the country, which will help keep their numbers down. This is the messy reality of data and data visualization. There is rarely one truth, one objective story. Data can tell multiple stories. The secret to finding truth and objectivity in data is to be sure that you can find those stories and weigh them against each other to find the ones that have the greatest truth. I've shown you data from two of the more popular sites for COVID-19 data, but all of the stories I've told here are still framed by comparison, even competition, between states and countries. They all do a terrible job answering a question: what is your personal risk where you live? To do that, you need to find out a local source of the current number of cases in your county or city. This is tricky because a great deal depends on testing. As President Trump correctly pointed out, if you cut the number of tests, you will cut the number of cases, or at least the detected cases. You won't change the actual number of cases. I don't know if he knows that or just wants lower numbers so he can tell a story of a decline in case numbers for political reasons. But what you care about as an individual is the true number of cases. I live in Santa Clara County. Our local paper publishes a 14-day rolling average of confirmed cases, which today is 14.48 per 10,000 population. Applying our earlier assumption that the true case rate is 10 times the confirmed rate, that means about 145 out of 10,000 of the population. That doesn't sound too bad, but then again, that's 1.45% of the population. That sounds worse. Then again, that means that 1 in 68 people I meet randomly is possibly infected and contagious. If I go into a supermarket that has 68 people in it, it's very likely that at least one of them is breathing out the virus. It's almost certain that the virus is in the air. Which is why I continue to use delivery services wherever possible, maintain social distancing, and wear a mask when I go out. I hope you found this exploration of COVID-19 data visualizations interesting. I believe it is essential that as many people as possible learn to examine and interpret data and data visualizations for themselves. Relying on interpretation by media and politicians is very risky. Even when they don't have bias or are trying to be objective, most of them are not skilled in interpreting data, especially the politicians. It is important to know how to seek out the original source data. Indeed, one of the surest signs that politicians are distorting the truth is when they block access to those sources. As hard as it is to find truth and objectivity with accurate data, it becomes infinitely harder or impossible with incomplete or inaccurate data. I invite and encourage you to watch my entire course, Objectivity in Data Visualization, on Pluralsight, where you'll learn these skills based on other real-world examples. You can sign up for free by going to bit.ly/ps-objectivity, so it won't cost you anything. While there, you'll find many other courses relating to data, along with some excellent courses on careers and technologies that can be particularly important to those of you who are job insecure and are looking to retrain in technology. Thank you for watching, and stay healthy. With luck, in the near future, examining the risks of dying from COVID-19 will become nothing more than a learning exercise.